Okay. Joseph Kleiman. I am the president of Buzz Health. We really, I guess, over the last few years have started to focus a lot more on the operations and the technology behind prescriptions and e-prescribing and the workflows and really trying to improve all that, make it easier for consumers. I figure if we do our job well, eventual adoption will ultimately result in a better experience for consumers. You know what? Eh, Not yet. I think that you have some EHRs that are a little bit more capable than others or a little bit closer to doing that, but the industry and the systems in general are still very fragmented. You still have, some systems running on, HL7B2 and they're faxing and they're calling. And so until I guess everybody gets up to speed and decides to invest in their own infrastructure, it won't be completely ready. I think the biggest gaps you're going to have in this is you still have, when a request goes in for prior authorization, you still have people that they call, they check. It's not very streamlined. There's not a lot of automation where things should just happen. And I think a lot of that comes from everybody operating on the same data sets, having information that's readily available, making sure it's concise, making sure it's consistent, and making sure there's no variation between platform. It's crazy. It's a lot of people don't really relate um, prior authorization and then that getting better with better patient access. What you got to remember, whether it's insurance, whether people are paying cash for their medications, it's about friction points. And anytime there's a friction point between, your HCP or your provider prescribing medication and when the patient knows what they're going to pay, if anything, and how they're going to get it, there's an opportunity for bleed or for slippage. So anytime something can be consistent, whether it's pricing as a visibility that's real time, whether it's prior authorization so they know exactly the path they have to take, when that happens quickly and accurately, I think it bleeds into adherence and I think it bleeds into better pricing. I think everything feeds off of each other. It's kind of what I was just talking about. It's again, when you look at it, people say, well, that prior authorization, it doesn't really have anything to do with cost or it doesn't have anything to do with adherence. But one thing definitely affects the other one. If you don't know what you're going to pay, you don't know sometimes how you're going to pay for it. And if you don't know how you're going to pay for it or how much it is, you don't know if you can. And you end up not taking your medication or it takes you longer. You go off plan, you go off, what you're supposed to be doing, every piece. And I think people are starting to realize this and systems are starting to realize this is that they have to tie together. Everything needs to be consistent because they really do. Every path, it affects the other one. I think I think it's in three steps. I mean, the first thing is there's got to be some honesty about who's ready and who isn't. Um, you got to evaluate where you're at. Second part of that is you've got to be willing to invest in your systems. You've got to be able to talk to your technology providers, find out what you need to do collectively or to be part of something that is more consistent. How do you all get together? So listen to them. And the last part of it, you got to be willing to invest. It's important. You got to acknowledge, you've got to see what else is out there, and you've got to be willing to invest. Not it doesn't always have to be time. It's got to be our money, it could be time as well. You got to be willing to do all three. No, I think what you're talking about and what the industry is talking about is really important. Buzz Health a few years ago, we decided that it was really important to spend just as much time on the other side of the coin as in getting medications to consumers directly through BuzzRx and working on systems. Because I do believe, and we believe at Buzz Health, that if you provide better systems and you make things easier, and you make them affordable on the business side, it'll ultimately result in better experiences and better outcomes for consumers.